Okay, it's 3 o'clock. So, out of respect to everybody's time, we'll get started. So, I'll start by introducing myself and then we'll introduce Kristen and Ricardo. So, as for the ones who do not know me yet, my name is Dr. Akil. So, I'm one of the emergency physicians. I have a long list behind my name, so I'll do briefly. So, I'm trauma team leader at Western and emergency medicine academic director at Western University, Windsor campus. I'm a medical director for air transportation company, and at the same time, I'm a developer or one of the developers of MCCQBank, which is the kind of subject of our talk today. The purpose of this webinar, it's only 30 minutes and brief. We've been doing those webinars every 6 to 8 weeks, roughly in average, to talk about the exams in order to guide and answer the bulk questions we receive almost on a daily basis. Mainly from IMGs, obviously CMGs. I teach them at the university myself, but I'm an assistant professor at University of Western too, so I teach them at the university. But those questions I usually receive via WhatsApp messages, emails, and sometimes I fail to answer all of them. So sometimes we're taking advantage of those webinars to answer them all. But this time it's a special time because we have a new guest, Kristen Batten. She's a third-year Canadian international medical graduate in her third year. The reason she's with us today is to give us her student. Every time you listen from me, it becomes boring. It's like father talking to their kids. Sorry, I know you guys sometimes maybe my age or younger or whatever, but sometimes listening from a student who like Kristen will give us a kind of a better idea of what to expect. So Kristen finished both her exams recently. She got her score a couple of weeks ago. The NAC-OSCE, she did extremely well. She's proud. I'm proud, and very happy for her. And she will give us an insight of her experience. I'm currently talking from Windsor. If you see behind me, the weather is really nice. I don't know why my picture is blurred. You would have seen my cherry tree. And Kristen is in Ontario currently. I'm not sure exactly which town. She's just finished her emergency medicine rotation. So I'll stop at this point. Otherwise, I will never stop and give the microphone to Kristen to introduce herself, and she can talk about her experience in the exam itself.
Okay. Hi, everyone. I'm Kristen. I'm like Dr. Akil said, I'm a medical student. I'm an IMG, but I'm from Canada originally. So I'm back in Canada now, just finishing up some electives here in emergency medicine and family medicine. I wrote my NAC-OSCE and MCCQE back in May, but I think today's focus is more on the NAC-OSCE and kind of the setup of it and what to expect the day of the exams. I can't give anyone like the stations that I saw because we signed a contract, but I just wanted to help like kind of like what to wear on the day, how to prep for the day, and what to expect on that day. Because I know going into it, it was something that I had no idea what to expect, other than help from things I heard. But it's hard because I feel like a lot of schools don't practice NAC-OSCEs and you don't kind of know the etiquette going into them. So it's super stressful. Um, Starting kind of on the day of the exam, you get there early. There's two stations. There's twice a year that they happen, but during the day, there's a morning session and an afternoon session. So the morning session, people are in a different kind of section of the testing center, and you're in another one, and there's no crossover. So like they make it very strict. Like once you guys are in this room, you cannot leave because the other group's kind of coming out. So that way, there's no conversation between the people. They like you to arrive, I think it's like an hour or two ahead of time. Business casual dress with your white coat is really important. Stethoscope, and then they provide you with a little notepad and paper for the day. It's probably about this big. And they give you a little pencil on the side, and that's what you have to write with. If your book fills up, then it's done. You can't open it until the first buzzer of your first station, and there's no talking and there's no looking around and there's nothing in between. So once you're kind of in there, you can't eat on the floor, you can't drink, you can have a little bit of water on the floor, but snacks are for outside, and then yeah. So there's 12 stations total. 10 of them are going to be marked. Two of them are pilot stations, so they don't count towards your mark, but you don't know which two are pilot stations. You treat them all like you're going to be marked on them. And after writing mine, I thought I would know kind of which ones were the pilot based on maybe I thought maybe they'd be harder, maybe they'd be totally offset. No, you have no clue which ones are pilot stations. So each station is about 11 minutes long, and depending on the station, they allocate a certain amount of time depending. So some stations, they may say like, only take a history. Some stations may say take a history and do a physical exam. Some say counsel a patient. Some say someone's coming in to interpret their results of a test they'd already done. I think it's definitely focused on history taking and just your communication skills. And then from there, you can kind of branch off into either history and counsel or history and physical. I've noticed that the physical exams, they aren't full physicals. Like you're not spending your entire 11 minutes doing a physical exam. They want you to take a history and then do a physical. So they want you to be really good at like doing a condensed physical. You're not looking at every single organ of the body, you're looking at pertinent organs. So if they say something about like infective endocarditis, you want to look at like all the things that you can think of surrounding that. So fingernails, listen to the heart, that sort of thing. Um, or if they say something about like fluid in the lungs, maybe you want to look at like pitting edema in their leg. So you definitely want to like address the pertinent parts of the body, but you're not gonna have to look in everybody's ears or look chest everyone's pupil reflex, stuff like that. Um, what I did, because you kind of you go in a circle, so every door is a different rotation or a different case, and then there's three um, rest stations where you can't use your notepad, you can't write things down, you can't make notes, you can't do anything, you just sit there. So before each station, you have 2 minutes outside the door to read the small vignette and the small what they expect from you. So whether it's just history, physical and history. And so I had my notepad and I wrote down on every single one an acronym that I used. Used the acronym PQRSTAA for anyone that had pain. And this is like the position or the place of the pain, the quality of the pain. So is it sharp, dull, burning? Does it radiate? How's it severe out of 10? The timing, when did it start? Sudden, gradually, constant, intermittent? Does it get better or worse? Previous episodes. A, associated symptoms, so like fever, chills, nausea, vomiting, and then the other A, aggravating and alleviating factors. So every time they'd say someone was, I maybe thought they were in pain, I would go through those questions or that acronym. Then I would use the next one for general like symptoms. I'd use OSCFD, which is onset. So when did it start? The site, where is it? The character to describe it, the frequency, how often, the duration, and the progression. And then from there, I would go into like more focused review of symptoms. So like, um, if it's chest pain, are you having associated shortness of breath, palpitations, nausea? So I kind of had a background in my head already knowing like if they have abdominal pain, what am I going to say? And if they have shortness of breath, what am I going to say? But you have to keep everything really open-ended. Another thing I like is like ice. So ideas like, what do you think's causing this? Concerns. Is there anything that you're worried about today specifically or expectations? Like, what were you hoping that we could do for you today? Obviously, you need to know their past medical history, past surgical history, medications, allergies, family history, social history, and then just kind of wrapping up and summarizing back to them so you don't miss anything. Like, just to clarify, so I don't miss anything, this started 2 days ago, you experienced this, blah, 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 blah. So I found that gave me a really solid foundation of what this patient had going on. And if you know your medical information well enough, usually you can come up with differentials in your head. At the end of each station, depending on the station, usually if they had like a question section, the last 3 minutes of your station would be left for questions. And during that time, the examiner would ask you, what do you think's going on? What test do you want to run? Like, there's so many questions they could ask you at the end of it. You have no clue. But things I'd always keep in mind doing it was like, what are my differentials? Biggest thing in Canada I find is don't kill the patient. Practice safe medicine. So, like, even if you don't necessarily think they're having a heart attack, you need to say, I want to rule out a heart attack by doing this exam. Or even if you don't necessarily think they're having a pulmonary embolism, I want to do this exam to rule that out. And I find that was like the biggest thing that kind of got like maybe a smile back from an examiner, like, okay, you know that this is the worst case. And I'd be like, my answer is probably this, but I would want to run these tests to rule out and practice safe medicine. So that's something I stress like in every single thing, especially like after my experience in the emergency department in Canada the last couple of weeks, is that like think about worst case scenario because if you rule that out, then you're kind of smooth sailing from there. So that's like my biggest thing is like obviously doing that. Another thing I found that you need to do is definitely communicating like bad news and being there for somebody and like empathetic and expressing um I don't know, just like having a conversation where you're not looking at the medicine but looking at the person as a person. I find that is really big because there's definitely stations where you are expected to be more empathetic and you are expected to um kind of just like explain bad news to somebody or break bad news to somebody or sit there and comfort somebody while you're giving them results from a previous lab test. So those kind of ones you want to keep super open-ended and give them the time and give them the space that they need to make decisions and like kind of make their own answer their questions in the best way possible. If you're breaking bad news to someone, you need to break the bad news to them. You can't just beat around the bush and have this conversation where you're going in circles. It's very important to make it clear that this is what is going on, but you're there to support them and you're there for them and like their future. And you're happy to talk to them or happy to talk to family members, whatever they need in this time. It's totally patient oriented. Um, so yeah, I think another thing before exams or washing your hands, sanitizing, they always have hand sanitizer, obtaining consent from the patient. So like, are you okay that if I perform this today, expose them appropriately if they're in a like a gown. You're not taking off their entire gown. Do you mind if I just see your shoulder for a second? That sort of thing. Performing key maneuvers that you learn. I definitely think it's important to have a solid medicine foundation because if you need differentials, you need to know in your head what you're thinking of. I know some people like to write the NAC in May and then the MCCQE in September or something like that. But I think it's really, really important to make sure that your foundation of medicine is solid before going into the NAC. So that way you're able to make those differentials like they'll give you lab values, sometimes they'll give you an X-ray and you need to like decipher what's going on or an EKG. So you need to have your medicine basics so you can know what you're even looking at. Like what's this X-ray telling me? What is this blood work telling me? What is this EKG showing me? If you don't know those things in that station, you can get a lot of marks from the history and the physical exam you performed, but the final diagnosis at the end, you still need to know, which I think is really important. For practice, there's definitely like online platforms, which is MCCQbank that Dr. Akil's making has NAC-OSCE
Do you
practice
mind?
as well. But yeah,
Do you
just
mind if I
practice.
interrupt you for
Yeah,
1 second,
absolutely.
Kristen? I really appreciate it. So we took 15 minutes here for your breath, and I'm really, I know it's extensive information. Do you mind if I ask you a few questions?
Yeah, of course.
Okay. So just to confirm, Kristen is a student who just performed very well in her exam, and she just did it, so she's very fresh. And I'm actually an examiner, so I actually used to examine for NAC-OSCE. I don't do it anymore for conflict of interest. Last time I did it is 2023. So all what she's saying is accurate. I just want to add few details into diagnostic and physical. Then I'll ask Kristen questions about her experience overall and how she kind of get prepared personally. Um, so things as an examiner, what I look for. First of all, there's no way even examiner know which two stations are a what do you call them pilot station. No one knows. Okay, that's number one. So neither the student or the examiner. So I don't know if the one I'm correcting to the student is actually a pilot one. Second, when we're actually bullet kind of check marking all the performance, we're looking at exactly what she's saying: professionalism, communication, uh, the way when you're doing the exam, how you're verbalizing your findings or the examination. So this is extremely important. When you're doing the exam, you're telling the examiner what you're doing. So I'm auscultating this part, I'm pressing on this part, I'm doing this, I'm doing that. Because just doing it without saying what you're doing, it doesn't give you the full mark. It's like acting more than knowing what you're doing. So I'm doing Murphy's sign, I'm doing McBurney's sign. Things that actually people do miss points the most, I noticed even at the university, like my students, the Canadian medical graduate, is things like basic things. They forget to sanitize their hand. The most commonly missed is draping appropriately the patient, introducing themselves or taking permission or consent from the patient before proceeding. Those are points. Every one of them is point. It's very important to know the diagnosis or your differential diagnosis. Usually you're asked more than one. If your one is within the three you tell me, then you're getting your point. But focusing on this is where people do get biased. So, for example, let's say somebody comes in with cough, fever, shortness of breath for the past few days, possibly pneumonia. And while you're asking the questions, boom, gotcha, I got pneumonia, and you anchor on the pneumonia. But the point of the exam is not to examine your diagnostic skills, is more to perform your OSCE skills. So you're really being tested on not the pathophysiology and diagnostics, which is part of the exam, but it is short part of the exam toward the end of the paper at the base. You're actually being graded on four different aspects. One of them is communication, professionalism, physical examination, history taking, and so forth. So missing important like OPQRST, the one she mentioned, you're missing points. Easy point. When did the pain start? If you don't ask that question, even if you get this pneumonia, you got the point for pneumonia, but you missed the point for when did the pain start. Missing the point for the question is as important as missing the diagnosis itself. Then, for example, performing physical examination. So now I know that it is cardiovascular related or respiratory related. Then I do not offer to do cardiac exam or abdominal exam. I lose a point. You have, even though, yes, she's right, you're not supposed to do full physical examination of somebody coming with a cough and a fever, but you still have to offer to do abdominal exam and cardiovascular exam. And usually the examiner will tell you to carry on. He will give you the point and will continue. But if you don't ask that specific question, you lose that point specifically. So I'm going to stop at that point. Again, the purpose of this is to give you an insight, is kind of mentorship and guidance. Most of the students do lack the guidance, not the knowledge, not the resources. There's so many resources in the market. You can pay as much as you want, but nobody guides you through it. And the people who ask, Kristen was one of the students who actually reached out to me originally, and she asked the right questions. And obviously, the people who ask the right question are going in the right direction. So there's nothing wrong with asking a question. There's something wrong if you have a question and you don't ask it because you're, I don't know, you're shy or something. So I'm going to ask Kristen a few questions. So in brief, Kristen, so when you enter, it's like a big clinic. Does it look like, I'm just going to put a visual into everybody's mind. Is it like a big clinic with doors, like one door, second door, third door, fourth door?
Yeah, it's like a hallway with multiple doors, and then
Okay.
the rest stations are just chairs in between some of the doors. So you
Okay.
stand when you knock, you stand looking at the door. You can't be turning around. That page, that 2-minute page you can read is right outside the door. Flip it up to read it. Write down whatever you need to. As soon as that buzzer goes off, you can walk inside, and it's a one ring.
Perfect. So you stand at the door, you see a paper, 2 minutes you have. You read the case presentation, Mr. Smith, 42-year-old gentleman, come in with cough and shortness of breath for the past week, past medical history, so on and forth. Please perform
Yeah,
history
take a focus
examination.
history and perform a physical exam. There'll be 3 minutes left at the end to answer questions. If
Okay.
you don't
So
see that 3 minutes at the end, then you go and you talk until the whole 11 minutes is up and then you can leave.
perfect. So in those 2 minutes, you have a piece of paper and a piece of pen where you can write your entire life story, right?
Yeah.
Perfect. You can write whatever you want. Your loved
Yeah.
ones, your names, your, I don't know, if you have rituals, or you can do your OPQRST, past medical history. So what if you go in and you get sooner? So again, as a, giving the other aspect, you go in, you knock on the door. I'm the examiner. I shouldn't do any facial interaction or facial expression with you as a student. But as soon as students sees me, they get extremely nervous. They don't only forget what they're doing, they forget their names. Like sometimes
Yeah.
you
So
introduce yourself and they actually fluster. The reason I'm
I always
specifically, yeah, go ahead.
I always walk in and say hi. I always dress myself as a medical student. I don't think it matters how
Good
you
job.
dress yourself.
Does
Um,
not matter.
it just be professional. So, hi, I'm Kristen. I'm a medical student coming to talk to you today. And then I say, I'm just going to wash my hands
Wash
right
in. Good
now.
job.
And I'm
Get
like,
point number one. So she got 2 points already.
and then is it okay if I'm the one to talk to you today? Are you comfortable
Three
with
points.
me talking to you to ask them consent? Are you comfortable with me having this conversation? Are you happy with this? Before
Perfect.
physical, again, I would get consent. Um, okay, after I've just
So
asked you the questions, are you okay now that we start a physical exam?
good job. So she got 4 points. You know how many students do miss those 4 points? I would say, and I don't exaggerate, maybe 40% of the students miss those easy points because they're nervous. What did you do to not to forget when you're doing the examination, not to forget what to do next? Like, you know how many
I
students
mean,
review the review of system is forgotten or forgotten past social history or past medication history? What do you do?
yeah, for me, mine was that acronym that I shared, and I
Good
wrote it
job.
down on the top of every single sheet. And then if I kind of was realizing I was running out of things to say, I'd quickly glance at it and then be like, oh, I didn't ask them this. So that saved me was that acronym. But I'm not gonna lie, my first door, I forgot to wash my hands. And as soon as I walked out, I was like, oh no. And then after that, it kind of clicked that, oh, I'm washing my
Good
hands
job.
now for every
Good job.
for them all.
And if
So
you actually miss a question or a step and you go back and do it, you get a point for it. So
yeah.
let's say, hypothetically, you did the physical examination. Oh, I forgot to introduce myself. You know how many times as a physician I finish the examination to a patient in the emergency department and they say, oh, did I introduce myself? My apologies. My name is Dr. Akil. I'm the emerge doc. Sometimes they think I'm a nurse or whatever the case is. So yes, you get the point. So if you remember a step second or third or fourth, you get the point. You just have to mention it. So those are four easy bonuses, but having those like mnemonic written on a piece of paper, including past medical history, review of system, past social history, medications, allergies, post-surgical, they are easy points. You just can go, if you can bullet point, like if you can blur them in 1 second, you get the point for them. As long as you're actually verbalizing them correctly and the examiner heard you. Good point. So you enter the exam. Do you face the examiner or the examiner is behind you?
The examiner, it kind of depended on the room. Usually one would be in one corner of the room and then like the patient would be in one and the examiner would be in the other. So they're kind of to the side of you. Um, Sometimes when I walked in, I kind of just addressed like, good morning, everyone. Hi, I'm Kristen. But you don't need to address the examiner. They're there to examine you. They're not the patient.
Okay,
So
perfect. So you don't interact at all with the examiner
no,
whatsoever.
yeah,
Yeah.
they're
So
just
even if you
there.
forgot something, okay, what if you forgot the case? So you don't know, you got in, you got so nervous and shocked, you don't know it's like a, I don't know, a sexual assault case where you need to consult and you don't remember, am I supposed to do physical or history? What do you do in that case?
So on the inside of the room, they have the same thing they have on the outside of the
Good
room.
job.
If you
So you can
forget,
access
you can
from
take
anywhere.
it. Yeah.
Okay.
But I always wrote down at the top, like, because you don't want to forget it, obviously. Like, it's the time goes by really fast. Like, some of them I would be like, oh, there's no way I'm going to be able to talk for 11 minutes. Then all of a sudden you hear the buzzer saying 3 minutes left, and you're like, I've got so much more I need to add. So you
Good,
definitely want
good,
to go in with a plan of action. And already based on like what that little vignette said or blurb, I kind of came up with my differentials outside the door too. So
good
if they
job.
came in with abdominal pain, I'm thinking, okay, they're 50 years old and they've got abdominal pain. What workup do I want to do and what questions do I want to ask to get to my differentials? So
Okay,
that's why I think knowing medicine in like its basics is definitely super
100%.
important because
So
it
doing
directs your
MCCQE1 before NAC-OSCE.
yeah, it definitely I wrote it after, but I was studying hard for it while I was doing it.
I agree.
But it definitely helps guide your differentials and helps guide your questions. You're not totally lost.
Perfect. So you introduce yourself, you do the history taking, you do the physical exam, 8 minute buzzes, beep, and you stop interacting with it. Can you ask the SP any more questions? Do anything after the 8 minutes?
No, what
No.
if you only have the 3 minutes left for questions, it's just question and answer. You and once you write list once you answer one question, you can't go back to it. So you can take your time answering it. And then for your, not every like case has that 3 minutes. Sometimes you just talk to the patient the whole way and
Correct.
then leave. If you're done talking and you've got nothing else to say, you have to sit in the room and be quiet. So
Good
you
job.
kind of want to like, I always found something to say because I found it kind of awkward sitting there. But
Yeah.
if you have nothing else to say, you say, well, thank you for your time, and you just sit there and you wait. So
I tell my student this is called awkward silence, but that's
yeah.
actually a moment where you can review your piece of sheet and see what you forgot, and you go back and look at the patient. So within the 8 minutes, let's say you finish at 6 minutes. This is my hint. And now, oh, I forgot to auscultate the chest. I forgot to offer neurological exam. I forgot to ask neurovascular. I forgot to do the reflexes, hammer reflexes. All what you have to do is just go back and do it. You get the point, or at least offer it, and you get the point. 8 minutes are done. There's nothing to be done with the patient. That's it. You're done. Anything you do past this point is actually works against your, it doesn't work for your benefit. So 3 minutes will hit. What would be the first question commonly? Like, what's your differential? What's the
Yeah,
investigation?
the questions honestly, I don't know, like I was shocked at some of them. I'm not gonna lie. Like some of them I definitely needed to know medicine. For the most part, like differentials, next step,
Yeah,
like what are you gonna do are things that you definitely need to have in your mind. Some of them I was like, oh, I didn't expect that. But I think for every diagnosis, it's safe to know your differentials, safe to know which imaging or which test you would run next, safe to know who you would maybe consult to or who you would refer
good job.
to, and it's safe to know how to treat it. I think if you
Okay.
know those things about the diagnosis, then those are all safe points. Could they throw something else at you? Absolutely. But I think that if you know at least those three things about a patient and the diagnosis that you're choosing or the differentials or how you would maybe differentiate this from this, that's a really, really, really good base to have.
Perfect. I'm going to add to that things that you will get a bonus point easily by just mentioning. For example, if somebody comes in with abdominal pain and a female, can you do, I'm going to ask Kristen and she can answer that. Can you do gynecological exam?
No, you wouldn't
No.
do it at gynecological.
Breast exam?
No.
No, don't. Okay. Do you have to offer it?
You like, yeah, you
If
would
it's
offer
appropriate
it.
to receive, you
Yeah,
have to
you would
offer it
offer
and you
it
get the
and
point
then
to
they
offer
would,
it.
yeah. I
So
found
those
during
are
the
like bonus
physical
points.
exams, like they would tell you, like if you're listening to all the lobes of the lungs, they would say no findings. And then you stop there. Like you don't waste your time and keep going. Like if there is findings, they'll tell you. And if they don't want anything, then they will say all clear. So stop,
Exactly.
move on. Like
That's
don't
it. Done.
waste your time.
When they say move on, you move on. You get the
Mhm.
point. So if you offer those, which is it's a must offer, it's a part of OSCE, you get the point. If you don't mention it, you won't get the point. It's not something you need to do. You just have to mention that. But in
Mhm.
order to know this, you'll have to actually have a comfortable flow in order to perform that.
Yeah.
Okay, for the sake of time, we have 4 more minutes. I'm just going to briefly tell you what's going to be next step. Next step is actually, I compiled, I've been working on this booklet for NAC-OSCE. I compiled around 40 pages of NAC-OSCE guide and instructions. We will be emailing it to you later, I would say by tomorrow. And this is a part of our NAC-OSCE crash course that we've been developing over a period of time. Previously, we used to have Oscar. Up to today, we still have the old version. As of tomorrow and going forward, we'll have the newer version. Please do not install the application or do any membership yet. But the way we did it is so the two steps. Step number one is the booklet. It's a 40-page. Will tell you every single thing actually Kristen said, in addition to other details like special tests, special exams, and details like that. And those could be your like almost Bible for NAC-OSCE. We will briefly hover over MCCQE1, yes. So this is for NAC-OSCE. You receive it by email. The crash course that we developed, we will be launching today, tomorrow, and finalizing. It's actually now it's in the live phase, but it's not compiled appropriately yet due to some design issues and technical issues, and we're missing some aspects. It is currently will be launched around 42 cases by tomorrow, and the 42 cases are exactly as Kristen mentioned. So they are like 2 minutes where you read the case presentation, then you have 11 minutes where they are timed and untimed. Then you have 11 minutes where you have to actually ask those questions, whether it's history or physical. And then the 8 minutes are over, it automatically shifts you to the 3 minutes. If you are untimed, obviously nothing shifts, you have to press next. In the 3 minutes, you'll have to ask, you have to answer by typing what is your differential diagnosis, what's your management, and what is, or some investigation interpretation, or what is your next step. The way it is right now, it's made for you to practice, practice, practice. I'm going to ask Kristen this question. How long do you think you practiced for NAC-OSCE? How many months?
I started in January and I wrote in May, and then I was actually living with a friend who wrote it the same day as me, so we practiced all night,
Good job.
every night for like I'd say solid like 4 6 weeks.
Yeah. So I usually say my 3 to 6 months is the exam preparation, and the way it works, you have the application, or you have the phone, or you have the laptop because it's an application and a phone. Your partner will actually listen to what you're saying. So you will be, if you have a third person, or you can perform on the person who's actually examining you, they will be opening the page. You don't see anything as a user or a student. You'll be asking, you say, I'm going to wash my hand. You say, I'm going to drape you. You introduce yourself. Every time you say any of those, the user or the examiner or your friend will press highlight the green light, highlight, highlight. If you miss it, it's not highlighted. And then you ask how long you've been having chest pain for. And when they find that answer, they will click it and will tell you, will pop up something, say, I've been having chest pain for the past couple of hours. Or how long you've been coughing for. Then you click it, it will give you the answer for 3 weeks. Or do you have any past medical history? You'll say no. If you highlight that, it will tell you no or yes, or what is your past medical history. The purpose of this is not to be cumbersome. For example, if you go to one of those businesses where they offer you a NAC-OSCE crash course, it's 2 days usually, and you pick up $1,000. Is it enough to pass the exam? You'd be lying to yourself if you say yes. This is just to have case scenarios where you practice. And the goal to have around 250 cases by the end of this next couple of weeks total, where you can practice them up to a certain point where you actually can memorize every aspect of the organ presentation. So if it's a joint pain or knee pain or chest pain or whatever the case is, gynecological consultations, contraceptive consultation, a post-surgical consultation, pre-op consultation, any of those will be there and we can practice. Within that crash course, you have the guidelines or guide and NAC-OSCE guide and introduction to NAC-OSCE in that application. If you wanted to, for example, meet with Kristen, I'm giving Kristen as an example, or other students, or not personally meet, no, that's not what I meant, sorry. I meant if you want to meet with one of the student or residents in order to practice cases, you are more than welcome to send us a request. Resident are going to the second year, and we've been extremely busy with the resident, but we have more students available in their fourth year who've done the exam who can do it for you. Is it good to have those courses where you pay a couple of thousand? Yeah, maybe it's good, but it's not enough. So you really have to study over a period of few months. Okay, so I spoke really fast to finish at 3:31. Whoever wants to drop the call can drop the call. Then I will continue for 4 more minutes. But before I do that, I would really say thank you to Kristen. I really appreciate your time and effort. I know you've been having a really stressful, busy season and time and personal and professional level. But I'm pretty sure she is happy to help as she was helped before. So it's kind of paying forward.
Yeah, definitely. I'm happy to help anyone. So you can reach out to Dr. Akil and then he can let me know if anyone wants to practice sessions or anything like that. So
perfect.
Yeah. Good luck, everyone.
Thanks. You can stay, Kristen, you can drop it if you want to stay. We'd appreciate your presence, obviously. So next step will be just purely 5 minutes. I promise not more than that. This video will be actually recorded. It will be sent to you and will be on our YouTube channel. Second part will be an AI summary of all what Kristen said and I said will be sent to you. Plus, as of tomorrow, if you are interested in joining our crash course that you study on your own with your partner for very cheap, less than 150, I don't even remember the price, I don't know, $150, something like that. You are more than welcome to download it. Just please be patient with us while we're working through our technical and design issues. We are working on it. We are aware of it. It will be perfect, hopefully sometime soon. The second update for the people who are waiting for our 1,000 questions and crash course update, it is currently being Dr. Galdo. I know we spoke about this before. So the questions will be uploaded. The crash course will be updated. So we have around 350 questions out of 1,000 questions been psychometrically approved to be uploaded. So we're going to be uploading them hundreds at a time so we don't crash the application. Total of 1,000 will be soon. I promise. I know I've been promising for the past few weeks and months, but finally we approved the first 375 to be uploaded, and the rest being currently approved. Hopefully we'll have the next batch loaded soon. The crash course, the MCCQE1 crash course, the way it is right now, it is, as I mentioned before, it's a PowerPoint format, but we're doing it more interactive. It's boring as heck as it is right now. It's more of like a high yield must know for the exam. The way we're updating it, it's supposed to have a test my knowledge. So you go over like 20 slides, for example, in the PowerPoint, you press test my knowledge. It will examine you on the previous slides through questions, multiple choices, or flashcards. And it will start developing mnemonic as you go and where you can compile them toward the end where you can review them. The crash course is not live crash course. It's a PowerPoint that covers the high yield, what you must know in addition to your Toronto notes. This is in brief. If you guys, as I mentioned previously, and you may know that if you actually purchase our combination plan or bundle plan, so let's say if you purchase the crash course, NAC-OSCE, MCCQE1 and Question Bank, which is, I don't know, worth, I think, $330 to $400+ with or without the promo code, you are eligible for 1 full hour to meet with me in person, not in, like virtually. and we can discuss it and mentor you, whether you need guidance for the CARMS or your application or your CV or anything you want, or exam or testing or examine you. It's a full free hour that's worth $250 if you were to just connect with me personally. Other than that, as I mentioned, Kristen and other students are available for you if you want to meet with them in virtually to test your knowledge, or you want to do some kind of sessions over an hour. You can actually send us an email and we will connect you with the appropriate personnel, obviously based on their availability and schedule. All of them are in rotations and doing their exams currently or finished their exam recently. For the MCCQE1 resources, one thing Kristen would tell you and I tell you is please do not use UWorld. Maybe that's one best advice. Advice number one. Advice number two is please, please, please use mcc.ca questions. So now the questions, one of the sets is worth $1, and the rest of them, yes, do not purchase anything until tomorrow. So if you want to buy something from our app, just wait till tomorrow. So what mcc.ca have, they have a group of questions that actually previously maybe practiced or used through MCC, but they're very similar to the exam itself. But please do not use them to practice, use them to test yourself. So when do you use those? Use them toward the end, 3 weeks before the exam maybe. Use those questions to see if you're actually performing well. If you don't know, connect with me. You have 3 hours to connect with me. I will answer your question. I'll tell you if you performed well. If you do not perform well, then stop and push the exam another 3 months or whatever time you need to. So 2 advice. Advice number 1, know USMLE UWorld. UWorld question 2 is please use mccq.ca questions after you practice a question bank of your liking in the market. Yes, ACE-QBank everybody's using. ACE-QBank, I think my theory, I never tried them. I think they use the American style questioning. I found they are hard for the exam itself. They are not very similar. There's Canada QBank. I honestly tried them myself personally back in the days. I did not like them, and I found out they're American resource. Ours seem to be the most similar. Actually, if you practice our next, it will be creepy how close to the exam it is. We selected the top student at our university who finished the exam at a 97 percentile, and we asked them to develop question based on the Toronto notes objectives. So we covered every single objective of the MCCQE1 exam. Every objective is four questions. So every objective of MCCQE1 exam is questioned in 4 different ways. If you end up doing our new generation of question, and you end up doing the exam, you'll be creeped out how similar they will be in style. There's no way we can tell what they're going to ask you. So the difference between us and others, for 2 more minutes, I promise, is everybody sells question bank. We have crash course and question bank for the price of question bank. So you can actually have the material to study and you have the questions to do. That actually takes more effort from us to update every time, but it is at least a good, I think, what students need to have in order to approach such a high-stake exam. Last advice, please do not gamble with your future. Please don't go blinded to the exam. If you're unsure, connect with someone and ask before you step forward. I'm out of breath at 3 hours, 38 minutes. So I'm going to hover over the question that's been sent and see if I can answer any of them. I think Ricardo will give you a promo code. Am I correct, Ricardo? So Ricardo is our marketing manager.
Yeah, just sharing it right away.
Okay, chat. So memorize that promo code to save, I think, 25%. So let me go over those questions. And if you have other further questions, you can send it to me via email and we'll forward to the appropriate. If you have question to Kristen, we will forward the question to Kristen. When will the NAC-OSCE be out and how it's accessed? So if you download our application and web app, you actually go to NAC-OSCE crash course. Now it says Oscar. This will change to NAC-OSCE crash course. Then you can download it, pay for it, which is an abysmal amount, and then you can practice it as much as you want. And if you don't like some of the questions, just send me a personal email and I will work on it personally. Do they make it easy to actually follow the time because it feels short? No, I don't think they care. What if I ask all the question, but in the And I still don't know. Yeah, so you just missed the point for the diagnosis. The majority of the point is not the diagnosis itself. The majority of the point is asking the right question, doing the steps, washing your hand, introducing yourself, asking for permission, doing the appropriate OSCE examination. And toward the end, if you answer the right diagnosis, you get your point. If you don't get the point for that specific selection. What of the MCCQ? So MCCQE, download our application, mccQbank. It's an application. Go to our website. This is the shared with Ricardo. Can you share it on the screen as a shared screen, not in the message?
Yeah, sure.
Okay, so what we'll do is we'll compile. If you have any question, go to our website, which is mccQbank.com. You can send us an email. You can join. You can meet with me actually over 15 minutes via Calendly if you wish. You can we can answer all your concerns. And otherwise, this promo code, just save it, and we will follow with another email by tomorrow with a recording and briefing in addition to NAC-OSCE guides and instructions. Okay, screenshot this code and use this code webinar 25 and you'll get, I think, 25% off. Next, MCCQbank good. I'm going to be very honest with you. MCCQbank is very good for medical knowledge, not for the exam. No, not for the exam. No. Geek Medics for OSCE, yes, Geek Medic for OSCE is good to know your OSCE steps. Not for the NAC-OSCE exam, though. But yes, you need something like that for sure. Are you eligible for, sorry? Last month, am I eligible to get the update? Yes, everyone is eligible. And if you miss the update, you actually have an extension for free. No worries about that. Yes, you can subscribe for Oscar now. It's just a little bit of jumbled information. There's lots of correction need to be done. But yes, you can. But NAC-OSCE, it will be as of tomorrow. For the station, what is Geek Medic to practice OSCE station? What about? Yeah, you can use it. It's not for the NAC-OSCE exam, though. It's good for OSCE practice, yes. What station, like history station, would be focus history? Okay, those is a specific question we can answer on offline. You can, if you want to buy them separately, you can. But if you buy them in a bundle, you save around 40% or so. And you get the free hour with me if you need to meet with me for any testing or test my knowledge or practice. Where should I start studying from now? Okay, so you can use the question bank. You can use Toronto Notes. Toronto Notes will be a good start, I feel. Yes, there is digital clock in the room. Kristen, there is digital clock in the room to see the time or no? I don't remember personally. Is ACE-QBank enough? No, 100%.
Okay, sorry, I wouldn't let me unmute. Digital clock, there is, yes.
There is, okay. So they can watch your time.
Yeah.
Before it beeps. Is ACE-QBank, I've heard lots of negative on ACE-QBank, people failing by using it because it's so hard. It's like using UWorld. You can perform very well with UWorld and you can fail the exam. I know you said to not practice MCQ. Yes, you have to start with the crash course first, then do the questions after, and then do mcc.ca. So if you go to our application to buy the bundle, you have to go to the bundle section. Beside the unit section, there's bundle section. Individual, then bundle. Which QBank do you recommend? I think I recommend my QBank, MCCQE. Which QBank? Honestly, Kristen, say your honest answer. Which QBank do you, because I didn't ask you that question. I know you used ours. Did you use any other question bank?
So I have to write the US boards for my exam. So I did use UWorld for my step 1 and my step 2. And I used Melman's for my step 2. I did not think that they're helpful at all for Canadian exams. I think they're very, very different. I use the MCCQbank, and I also paid for the practice test from the actual MCCQ website.
That's
and if you look at the style of question from the MCCQbank to that, like the official MCCQ test, the style of question is like very, very, very similar. But I don't think my US boards questions help me at all with my Canadian, other than just like knowing knowledge. But the style of question and the type of things asked and the content was just not the same.
It's like an athlete practicing for a marathon and compared to an athlete practice for a 100-meter sprint. They both are running, but they're completely different things.
Yeah, I didn't expect them to be as different as they were until
Yeah.
I started studying. So,
Okay, so if you have technical issues, please send us an email and we will go over it. ASQ is not enough. You can see the bundle. If you have any technical issue, please send us an email and we'll guide you through it step by step. The QBank Kristen used, she told you in the NAC-OSCE there's AES assessment BLS. No BLS stations, no. Note is a must-have. It's your Bible for MCCQE1. How to get question bank? Through the application, download our application or go to the website. This is promotion. I don't know what you mean, but obviously we're promoting our own business. How do you get access to question bank that Kristen used? She told you she used your World for American. She used MCCQE1, which is ours, and she used mcc.ca. The name application, Android. Yes, that's the name application. Okay, so there's quite a bit of more questions I will have to answer offline because for the sake of time, I have a flight to reach shortly, and I need to finish before that updating some of the cases. So I'll be reviewing the NAC-OSCE cases for them to be ready, for 42 cases to be ready to be launched tomorrow. And what we'll do is every day we'll be launching 5 extra cases up to reaching 250 cases total. And I want you to practice those 250 cases 100 times. I mean, maybe exaggerating, but I want to extensively practice those cases in order to reach your exam comfortably. And I want you to flow through the physical examination and history taking very smoothly and comfortably so you don't get flustered and stressed in the exam itself. Our next webinar will be about MCCQE1 focused, and Kristen will be joining us too. And we might have one more actually resident and student joining us, depends on their time and scheduling, but definitely Kristen is actually shared her interest in joining our next, unless I'm mistaken, Kristen, am I correct? Will you be?
no, I'll definitely be here. Yeah.
Thanks. Okay then. Thanks again. Thanks, Ricardo. Thanks, Kristen. And thanks for everyone for attending. And send us an email if you have any issues. And if any technical issues, don't hate me. Listen, we are technical and design on budget. So this we are working on it. It just takes time. Okay, good luck.
Okay, bye.
Bye.